Alright, let's chat. Because it's been one hell of a semester. Oh my lord. Hey guys, welcome back to my channel. If you are new here, hi, my name is Ivy, and here I like to post everything about nursing school, lifestyle, and skincare. So if you're interested in that, then keep on watching. Today I'm going to be discussing my experience going through my third semester in my accelerated nursing program. I feel like in my previous two videos, I would always say the same thing. I was always like, oh my god, this semester was so hard. Oh my gosh, like it was so stressful. Looking back, I'm like, you don't even know what was coming. The first two semesters were a piece of cake compared to this third semester, okay? It was rough. Like, this was by far the hardest semester in the program. It's known for being the hardest semester, and I thought it would be similar to my first and second semester, but no, this was completely different. I feel like it affected me mentally, emotionally, even physically, because I was just sitting all day either studying or sitting in class or sitting in the car commuting. There was literally no time for anything else. Like, I feel like I was literally like breathing and eating nursing school 24/7. This semester was extremely difficult, and I know administration in my school realized this because my cohort is actually the last cohort to go through this curriculum. They changed the curriculum completely because what was happening was that third semester was way too intense, like jam-packed with too many classes and too many things at once. And then fourth semester is too light. It's like a breeze, and they realized this. So for the incoming class, they actually changed it and they distributed all the classes evenly, so it's a little bit easier for them, so they're not as stressed out and as miserable as we were. The good thing is that because I was able to get through this third semester, that means that fourth semester should be pretty easy. So it's like, oh my god, we have a life? Like, we have free time? Like, what is that? So let me first tell you guys my experience going through it, what made it challenging compared to the previous two semesters, what got me through it, and what you can do to prepare if you are taking the following classes. So I was taking Adult Health 2, OB, Pediatrics, and a Trends course. So what made this semester difficult was that Pediatrics and OB are completely new to us. Previously, we were focusing mostly on adults. We had done Adult Health 1, we had done Pharm, we had done Patho, but this is the first time where we were diving into completely new territory, so to speak. Peds is completely different. I mean, some things are similar, but it's pretty different compared to what we've learned so far. In terms of like everything is categorized by their age, everything is done by their weight. You know, like, it's not like Adult Health where you typically give like the same dose to adults. Like, no, in kids everything is weight based and it's just different. And same with OB. OB was different because now not only are we dealing with one patient, we're actually dealing with two patients, mom and baby. So we had to learn about both of them. So I think one of the things that made it difficult this semester is that this was the first time where we were really seriously thinking like nurses. The previous classes that we have taken, I feel like the exams were a little bit more straightforward. For example, with Pharm, you know, usually the exam questions would be like, oh, like, you get this patient, this is their signs and symptoms, or this is their diagnosis. Which of the following meds would you give them? And it was pretty straightforward. Like, as long as you remembered the classes and like what these meds, like, you know, how these meds work in your body, you could figure out what the answer is that would help that specific patient. Or like, you know, in Patho, for example, they could ask you something like, which of the following is a AIDS defining characteristic? And it would always be either like a CD4 level less than 200, or like Kaposi sarcoma, or like some kind of like Uvacis or Carini. Like one of those things. And it was pretty straightforward. Like, you knew, like, okay, these things equals AIDS defining characteristic. Now this semester it was like, this 45-year-old patient comes in, these are her vital signs, and they would give you like the blood pressure, the temperature, respiratory rate, pulse, oxygen saturation, all these things. and then you had to figure out which ones were normal, which ones were abnormal, and then it would give you a scenario. Like it could say they live alone, or they live with family, they presented with these symptoms, they have a history of these diagnoses. And then you have to figure out, okay, what is going on with this patient? First you have to figure out, are they in danger? Can I do something about it as a nurse? And is that within my scope of practice? And if not, do I need to call the provider immediately or not? Or a rapid response? Sometimes it was pretty hard because, you know, for example, I'm thinking of my adult health 2 class. Some of the questions would be like, they would give you all the vitals and then they would be like, is this person in shock? And if they are in shock, what type of shock? And based on that, what can you do as a nurse? And it was like you had to figure out whether, you know, depending on the type of shock that they're in, what to do as a nurse. Do we give them meds? Do we give them fluids? Like, what do we do? And if we've already tried all those things and they're still crashing, do we call a rapid? Do we do something else? Do we intubate? Do we, you know, like all these things. And I finally understand those jokes about people saying like, oh, like nursing school exam questions are like, these are all correct, but which is the most correct? Like that is very true. And I finally understood it this semester because there were several questions where I technically picked an answer that was right. It was correct, but in that specific scenario, it wasn't the best choice. It wasn't the most correct. That was kind of frustrating in the beginning because I was still trying to figure out, okay, like, how do I go about these questions, you know? And this was the first time where I did a ton of practice questions just so that I can get the hang of what they're asking for and really train my brain to think like a nurse, literally. Like I'm literally thinking, what is gonna kill my patient first, okay? And we need to work on that first. Or sometimes like some questions where like you walk into the ER and you are assigned the following patients. Out of all these patients, who would you see first? And usually those kind of questions are like, who is gonna die first? You're gonna go see that person first, okay? And they always put like different ages, like it could be like a kid, geriatric, or like different age ranges with like different medical histories and like different vital signs and stuff. And sometimes you would think that the one that had like the most stuff going on, like bleeding and crazy vitals, would be the one that you would go to first. But then sometimes the answer would be like, oh, you're actually gonna go treat the person who's confused or something along those lines. You have to really take every single part of the question into consideration, and then you have to figure out, okay, what is important and what is not important? What is hurting my patient and what can I do as a nurse? Is it within my scope of practice or do I need to call the doctor? I think out of all the classes, I think adult health too was the most challenging for me personally. So this semester, not only was it extremely stressful to the point where I feel like my mental health was affected at one point, but also I had chest pains at one point, which was very scary. And I was told that it was just stress. And then during finals week, I broke out in the worst case of hives I've ever had in my life. Like I've never had this before. I just broke out in hives and I was like, what is happening? Like I was just itching everywhere and everything was red. And I checked everything, like nothing had changed. I never changed my detergent or any skincare or nothing. I went to urgent care twice for it, and both times I was told that it seemed like it was most likely stress. I was prescribed prednisone for 4 days straight, which was horrible, by the way. Oh my gosh, prednisone is so bitter. It's such a gross medication. But anyways, I took it and they told me that if it continued and it wasn't something allergic and if it wasn't the stress, then it could be something internal that the stress triggered. With that being said, it's been 2 weeks since the onset when it first started, and I am still getting hives on and off. I've checked everything in my house. I have been deep cleaning. I don't know, hopefully now that finals and the semester is officially over and I can actually relax, hopefully the hives completely go away and it truly was just stress. The next point that I want to talk about is how did I get through this semester? And let me tell you guys, a big part of it was actually my clinical group. This was the first semester where I really clicked with my clinical group. This was the best clinical group ever. You guys probably have seen on my Instagram some of the shenanigans that we were doing during clinicals, and I posted a lot of like videos and stuff of us, you know, just having fun. My clinical group was amazing. Like, we helped each other because there was always like every other week one of us was feeling super down. A classmate fell down, like somebody fell down, and then seeing the group come together and try to encourage them and motivate them and cheer them up was much needed during those days when it was really rough. I just feel like my group truly cared for one another, and everybody was very respectful, super funny, very friendly, very loving. Like, it felt like they were such a good group, and I wish we could be in the same group again next semester, but unfortunately we're probably gonna get separated since we're going into our capstones and everybody chose different areas that they want to work in. So yeah, they also kept me very motivated. There were days where I just didn't feel like studying anymore. And then I would go into our chat and I would see everybody talking about like a chapter in peds or like a chapter in adult health, and they were like all reviewing, and it was like, you know what, I should be studying too. And I would join them and study, and then I felt better. I feel like we all excel in different areas. Like, for example, one of my classmates, she was amazing at teaching. She was so good at questioning us, at testing us, and like teaching certain concepts that we may have been confused about. There was this one classmate who always had snacks, and one of us would always be starving, and she would always save our life with snacks and water bottles, her Wesley bottles. My other classmate, she was very good at EKGs because she had been an EKG tech for like 10 years or something like that. So when we were learning about the cardiac system, she literally taught us everything about reading EKGs, what to look for, like everything. Like, it was amazing. Everybody seriously just had their own way of excelling or doing things that helps the rest of us somehow. I love my group, they're so good. If you guys are watching this, I really appreciate you guys, and I know you guys are gonna all be excellent nurses, and I would trust my family with you guys. Another thing that also made the semester difficult was the fact that we had 3 clinicals this semester on top of like 4 lectures. We had such limited amount of time to study and get work done, and also we had like clinical assignments that we had to do. So trying to do all of that in such a short amount of time was very, very, very hard. I know I've said this in my previous 2 videos, but like I really truly feel like this was a bit more challenging in terms of time management because of just how many classes and how many clinicals we had. And we also had a lot of assignments, like not just for lectures but also for clinics. Like, it was a lot. Oh, something else that I forgot to mention that I just saw on my phone was you don't really get a say about clinicals, like where you're going to be placed. So for example, for one of my clinicals, it was actually an hour away and I had to be there by 7 a.m. and meaning that I had to wake up by 5 o'clock in the morning and be out by 5:30 so I can get there on time to find parking, so I can eat something really quick and I can be there on time. Because even though clinic starts at 7, she actually always wanted us to be there 15 minutes early so that we can put our stuff away, get ready, so we can be on the floor at 7. If you got to clinic at 7, you were late. You actually had to be there 15 minutes earlier. And we would literally see the sun rise during our drives, and yeah, it was pretty depressing sometimes because like you were just exhausted from like an exam from the previous day, or you were just exhausted because you're trying to keep up with all the assignments, or you were just exhausted because you had to go to clinic and then the very next day you had a really hard exam. So it wasn't just about trying to keep up with assignments, but it was also like an endurance test. Like, how long can you keep going like this before you get sick or something? You know, like you had to make sure that you were eating properly, drinking enough water, spending some time for yourself to take care of yourself at times, and making sure you're getting enough sleep, you know, because if not, it was very, very easy to get sick or feel overwhelmed. And there were several times throughout the semester where we ended up having 2 exams on the same day or 2 exams in the same week. There was one time where we had 5. It was like 5 exams within 2 days. And it was the most stressful thing in my life. I think that was the day actually when I broke out in hives. Yeah, like towards the end of the semester. I'm not saying this to dissuade or discourage anyone from pursuing nursing, but I just want to share this information with everyone because I want to make sure that they are aware of the rigor of the program and just how hard it is. And I'm talking specifically about the accelerated programs because nursing school in itself, it's already very difficult, but an accelerated program just makes it 10 times harder because you're just cramming so much info in such a short amount of time. This is the first semester where I actually started questioning myself. I started wondering, like, am I enough to become a nurse? You know, like, am I smart enough? Can I really do this? That hadn't happened before in any of the previous semester. This was the first time where I was really questioning myself at one point from how difficult and stressed out I was. And I remember sometime that same week, somebody else in my clinical group brought up that topic, and they were saying that it was the first time that they were questioning whether they could be a nurse, whether they had what it takes to be a nurse. It opened up this whole conversation within my clinical group, and I realized that I wasn't the only one feeling that way. It kind of felt comforting in a way, like talking about it with them and realizing, you know, like, you're not alone. I'm not gonna sugarcoat it and say that nursing is fun. You know, like, you see on social media, like, all these people posting about, oh, like, you know, how fun nursing school is and how much they love it, and like they make it seem like it's all fun and exciting, but in reality, there are going to be times where you're going to cry. There's going to be times where you're going to question whether you have what it takes to be a nurse, and there's going to be times where the program is seriously going to humble you because, in my case, I've always been a straight A student. I've always been very good at being a student. I've always been very studious, and I've always completed all of my assignments on time, but this was the very first time where I was struggling at one point. I felt so bad because a lot of my classmates who are very smart students and had great GPAs were also struggling. And at one point, some of my classmates were failing the course. I think for our first Adult Health 2 exam, the passing grade was a 75, and the class average for the first exam was a 70, I think. I'm pretty sure it was a 70. All I remember was that more than half of the class failed that first exam. And I feel so fortunate and blessed knowing that I didn't fail a single exam during the semester, but there were several times where it messed with my head because I would study for so long and then I would get a grade that, you know, I would be grateful for, but I was hoping for something higher considering how much time and effort I put into that studying, you know? I hope this gives you guys like a realistic impression of what the program is like. If you are on your way to taking Peds, OB, or Adult Health 2, I encourage you to find a solid group that you can study with and make sure that you stay on top of all of the readings, all of the assignments, and everything that you have to submit on time. This was also the first semester where I didn't see my family at all. This was the first semester where I didn't have time to call anyone, to visit anyone. I was legitimately MIA. And I remember telling everybody at the end of the summer, after I completed second semester, I told them, listen, you guys are not gonna hear from me for the next few months. You guys are probably not gonna hear from me until like Christmas or New Year's. So just giving you guys a heads up that if I don't reach out to you or if I don't reply to any of your texts or calls, there's a reason why. Don't get upset. I just don't have the time right now. But yeah, I hope you guys find this video helpful. Stay tuned because I'm going to be making more in the following weeks, specifically videos about how I took notes, how I studied, and specific tips for each class. So hopefully you guys find those helpful. And if you guys have any questions, just reach out to me. I'll be more than happy to answer them. Okay? Alright guys, so that's it. Thank you so much for watching. I hope you guys enjoyed this video. Give it a thumbs up if you liked it, and make sure you subscribe. Alright? And I'll see you on my next one. Bye!